Over the last 20 years, I've developed a very complex hip replacement service. And I deal with a lot of revision surgery. And I remember one particular patient who had a congenital abnormality of their femur. And femur hadn't grown fully and was very crooked. And they'd had maybe 7 or 8 operations on their thigh bone over 15 or 20 years. They're about 54 years old. And they broke their thigh bone about 2 or 3 inches from their hip joint. And they were stuck in bed for almost 3 weeks before I was contacted about their plight. And the bone wasn't healing because of all the previous surgeries that they'd had. So I decided to replace the top end of the thigh bone and give them a hip replacement at the same time. And within 2 days of their operation, they were back up on their feet walking again. Without the surgery, they would have been confined to the bed for the next 20 or 30 years, perhaps. The procedure went very well. I did the operation in 2 stages. I was concerned that there was perhaps some infection as a result of the previous surgeries. So I had to remove the thigh bone first. And the patient stayed in bed for 6 weeks on traction. And I had to remove all the scar tissue related to the previous surgeries. And then 6 weeks after that, they then had the thigh bone replaced, and all the tissues healed up extremely well. And they started walking, as I said, 2 days after the operation. So the great thing about a hip replacement is recovery is very, very rapid. Providing the surgery is done well and the implants are firmly fixed. As a general rule, patients have the first day in bed recovering from the surgery, and we then try to get the patient up the day after. And the physiotherapist will come in and help the patient mobilize from day 2. And I think this particular patient, even though the surgery is very complex, they left hospital after about a week. And gradually their mobility improves over a month. And when I saw them in the clinic, all the wounds had fully healed. And the patient was up walking with a stick. Whereas prior to that, they spent 3 or 4 weeks in bed with a fracture that wasn't healing. The operation itself transformed their life because before they'd broken their hip, which was a pretty bad thing, they had a hip joint that wasn't moving properly because they'd never walked on it, and it was essentially fused. So there's no movement between the ball of the thigh bone and the pelvis. And as a result of the fracture and completely replacing the hip joint, they had a hip that was now fully mobile. So in actual fact, as a result of the fracture, she ended up with a hip joint that was functioning considerably better than it did before her injury. I think the thing that I was most proud of is that there was a lot of discussion that went on between myself and other colleagues regarding the best treatment for this patient. And there was a lot of disagreement as to what the best way forward would be. The patient's very complex problems get discussed at a multidisciplinary meeting. And the general consensus was that I shouldn't do any surgery for this patient, and that it was almost a problem that was irretrievable. But despite the advice and with a long discussion with my patient, we decided that we would attempt the reconstruction. And as it turns out, the reconstruction was very successful.